Welcome you all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about coagulation cascade. So first, what is coagulation? Coagulation means if blood drawn from body and kept for few minutes, it thickens and forms a gel. It's called as clot. This process is known as clotting or coagulation. Okay, that means if blood is drawn and kept in a tube, it forms after few minutes. Obviously, it will get some gel. Okay, it will get clotted. This process is known as coagulation. This process takes place in the blood vessel. Then it will call as thrombosis. Okay, if for thrombosis or for clotting it will take too long time, obviously there will be chance of bleeding, so we'll call as hemorrhage. So if the thrombus is swept away from the side, that means if thrombus is move away from the vessel, obviously we'll call as a embolus. It will go block in other place, that is embolus. Okay, so three different words. One is coagulation. Coagulation means clotting of blood. Okay, if that is happening in the tube, we call as a coagulation. If it is happening in the vessel, we call as a thrombosis. If that clotting will be taking long time, we call it maybe leads to hemorrhage. Okay, if that clot is moving away from the originate side, that is formation of a embolus. Okay, that is the difference. Okay, so next will be coagulation can be occur by three steps. Those are extrinsic pathway, intrinsic pathway, and common pathway. Okay. In this coagulation cascade, there will be some factors will be involved. What are those factors? We'll see in the following slides. So these are the coagulation factors. There are 13 factors will be there. Factor 1 will now known as fibrinogen. These are MCQ. They can ask any one factor and can then ask the name. Okay, that's why I'm repeating here. Factor 1 is fibrinogen, 2 is prothrombin, 3 is tissue factor or thromboplastin, 4 is calcium, 5 is proaxalin, 7 is there is no sixth factor, that is also MCQ. Okay, 7 is proconvertin, 8 is hemophilia anti-hemophilic factor A, 9 is anti-hemophilic factor B, also known as CRISPR factor, 10 is Stout factor, 11 is plasma thromboplastin factor, 12 is Hegman factor, 13 is fibrin stabilizing factor. Among these 13 factors, factor 4 is important. Next factor 7, 8, 9 will be important because these are will be useful in 9, especially 8 and 9 will be helpful in hemophilia disorders. So you have to remember 8 and 9, and there will be one factor will be missed, that is factor 6. Okay, these are the important regarding coagulation factors. So next we'll discuss three common pathways, that are intrinsic pathway, extrinsic pathway, and common pathway. Okay, first we'll discuss extrinsic pathway. If tissue get injured, okay, if outside the any injury will happen, that tissue will release tissue factor, it will activate factor 7 to 7A. Okay, this 7A will come and bind on X factor, factor 10, and activate it will be activated into 10A. This 10A with the help of phospholipase and calcium will convert prothrombin to thrombin. Okay, and this thrombin will activate factor 13, at the same time fibrinogen to fibrin. Okay, this factor 13 activate to factor 13A. In the presence of factor 13A, this insoluble fibrin will converted into stable fibrin. Okay, this is how extrinsic leads to common pathway. There how stable fibrin will get formed. We will see next discuss a intrinsic pathway. Intrinsic means when endothelial tissue vessel endothelial tissue get injured, it will release factor 12. Factor 12 to factor 12A activation. This factor 12A activation will lead to development of factor 11 to 11A. Next 9 to 9A. Next this 9A with the help of factor 8 phospholipase and calcium factors, it will activate or it will activate factor 10 to 10A. Okay, from this onward this common pathway will get start. Samely from extrinsic 7 to 10A. Samely here 10 to 10A. After that this 10A prothrombin to thrombin, thrombin to fibrin, fibrin to, that is insoluble fibrin to stable, that means insoluble fibrinogen to stable fibrin, that means fibrin clots will get formed. Okay, this is how blood get coagulated. Okay, this is the three pathway, that is intrinsic, extrinsic, and after this list two, they both have common pathway from 10 to 10A onwards. Okay, that's all. Thank you.